In the vast universe of human health, a particular sexual condition known as vaginismus exists. This condition is more than just a medical term. It's an experience, often challenging, that many women encounter. Vaginismus is a sexual health condition characterized by an involuntary contraction of the pelvic floor muscles. These sudden contractions tighten the vaginal entrance, causing discomfort, pain, and often making penetration difficult or completely impossible. The root of vaginismus can be traced back to various physical or psychological factors. Physical factors may include conditions like infections or trauma, while psychological factors could be linked to anxiety or fear associated with sex. It's a complex interplay of mind and body that can deeply impact a woman's sexual health and well-being. That's the nutshell of vaginismus, a condition that affects the sexual health of many women, causing involuntary contraction of the pelvic floor muscles. It's essential to understand and acknowledge it, to address it effectively and compassionately. Now, imagine a door that closes involuntarily every time someone or something attempts to enter. That's essentially what happens during vaginismus. To understand vaginismus, let's think about our body's natural response to fear. When we're afraid, our body instinctively tries to protect itself. In the case of vaginismus, this protective response is triggered by a reflex contraction of the pelvic floor muscles, often due to the anticipation of pain. The pelvic floor is a group of muscles that support the pelvic organs, including the uterus, bladder, and rectum. One of the key players in this involuntary contraction is the pubococcygeus muscle. This muscle forms a figure 8 around the vagina and the rectum, and when it tightens, it can make penetration extremely painful or even impossible. It's like your body is trying to protect you from a perceived threat, even when that threat doesn't exist. So, vaginismus is like an overprotective bodyguard who doesn't know when to relax. Vaginismus doesn't discriminate. It can affect any woman, regardless of her age, race, or sexual orientation. The roots of this condition are varied. They may lie in past sexual abuse or trauma, psychological factors such as fear or anxiety, or even certain medical conditions. The World Health Organization reports that approximately 2 in every 1,000 women around the globe are diagnosed with vaginismus. However, this figure may only be the tip of the iceberg, as many cases may go unreported due to shame or lack of awareness. When it comes to treatment, the approach is often multifaceted. Physical therapy can help women gain control over their pelvic floor muscles. Counseling can address underlying psychological issues, and in some scenarios, medical procedures may be necessary. The journey towards recovery can be challenging, but with the right support and resources, it's absolutely achievable. Understanding and addressing vaginismus can pave the way to healthier and more enjoyable sexual experiences.